This is a simple YouTube graphic video that is made to help people who want to use map learning in their teaching about cancer, cancer prevention, and cancer survival. Again, a very simple video. In this video, I will discuss the learning maps, how they relate to the formation of cancer and survival of cancer, and how you can use these maps to engage participants in map learning sessions so they can share their stories about the various focused scenarios that have to do with cancer. This first map is the overall flow map. It depicts cancer from its very beginnings at the top right corner, where it is a risk for getting cancer depending on various factors, each of which presents a scenario. This means this is a situation we can look at and generate stories. So we can look at the top right and see the family standing there, and we could talk about what they eat in terms of depicted by food, whether they exercise, by the track, whether they're exposed to various risks of cancer denoted by the clouds, the lightning strikes, and then the appearance of cancer. The two main features of this map are the cancer river that shows how cancer develops from its early stages as cells in the body and goes all the way through the river down around to lake malignancy. Along the way, individuals have opportunity to get on to the other main feature, which is the long life highway. This is the desirable path that people would take to live a quality life and avoid getting cancer. There are various on-ramps and off-ramps onto this road. There are various ways to go through the stream of cancer in a shortened or longer way depending on your lifestyle. The idea again is to move out of the stream and onto the highway for long life and quality. After receiving input from individuals who use map learning in the community, we broke that large map that you just looked at down into 3 sub-maps. One to deal with prevention, shown here, one to deal with screening for cancer, and a third to deal with the outcomes and survival of cancer. This smaller map blows up the area of prevention having to do with the previous story map so that one can focus more on the various scenarios or situations in which stories are to be told. Stories can be told about the people depicted on the map, or they can be shared by individuals based on their own personal life experiences. The map depicts various situations that people would probably confront in dealing with cancer, such as risk factors for cancer, like alcohol intake or cigarette or tobacco use, obesity or diet, or being physically active. We also see on here some churches that can be discussed in terms of their role. We can see a family heading down the stream together because of the way that they share their worldview and their family behavior. Also, you can see churches that are on this map, and you see a patient advocate shown at the top that can be important in learning about how to prevent cancer. The screening sub-story map shows the upper left quadrant of the larger flow map and it shows the various ways in which cancer can be detected in its earliest stages and treated in a more successful way. There are choices to be made on screening, whether or not someone gets vaccinated for HPV, whether they go and get a colonoscopy for the detection of colon cancer, or then there are issues surrounding screening for breast cancer, prostate cancer, and getting regular pap tests. At the bottom of the screening island, we can see what happens when people get screened, get abnormal results reported from the results of their test, but yet don't go back to follow up on that abnormal results and see a healthcare provider. They go back over into the stream of cancer out of the shortcut river that would have gotten them into treatment in an earlier way. Next, we will be looking at the map for outcomes. This map shows the outcomes of living your life in various ways with regard to cancer, whether or not you develop cancer, or whether you survive from cancer, or whether you have a quality of life beyond survival. It also shows the ocean of despair, that there are other health disparities that do contribute to the disparities in health that African Americans experience. This outcome map shows the stream coming over tumor falls, so that the cancer stream comes over the falls, the tumors appear, and then people usually go to an emergency room as a first step in getting treated for cancer. This is usually in a later stage of cancer. If they come down the early shortcut river or stream, they will come right into the cancer treatment center, may go then to other places for treatment, and then they can go into remission, meaning the cancer is no longer there. It can reoccur before they get to the older adulthood, and they may have to cycle back into the late malignancy in treating of the cancer. Again, this is designed for the various stories that people have to share in these situations. A special thank you to all those people who are seeking to educate their families, friends, and neighbors about cancer and what you can do to prevent dying from cancer. Please use this video however you need to educate yourself and others about the use of map learning. If you need to stop it at any time to examine the maps more closely, please do so. Good luck.